The morning sun filtered through the tall windows of Kensington Palace as Catherine, Princess of Wales, sat in her private study, reviewing the speech notes scattered across her mahogany desk. Her fingers traced the edges of the papers nervously, each page representing weeks of careful consideration and heartfelt preparation. Today would mark one of the most significant moments in her public life, a day when she would step beyond the traditional boundaries of royal protocol to address something that had been weighing heavily on her heart for months. The issue she planned to discuss wasn't new to her. It had been growing in her consciousness like a persistent echo, amplified by countless encounters with families across Britain who had shared their struggles with her during official visits. Mental health, particularly among young people, had become more than just another royal patronage for Catherine. It had become a personal mission that connected deeply with her own experiences as a mother and as someone who understood the pressures of living under constant public scrutiny. Her private secretary, James, knocked gently on the door before entering with his usual measured pace. "Your Royal Highness, the media team is ready for the final briefing. The venue has been confirmed, and we have responses from over 40 news outlets requesting coverage." He paused, studying her expression with the intuitive understanding that came from years of working closely with the royal family. "How are you feeling about today?" Catherine looked up from her notes, her blue eyes reflecting both determination and a hint of vulnerability. "Nervous, if I'm being honest, James. This isn't like announcing a new patronage or cutting a ribbon. This is about asking people to see beyond the titles and the protocol to understand that some issues are too important for traditional boundaries." The decision to speak out had not come easily. For weeks, Catherine had wrestled with the balance between royal duty and personal conviction. The monarchy had always maintained a careful distance from controversial topics, preferring to support causes through action rather than advocacy. But the statistics she had been presented with during her recent work with mental health charities had shaken her to her core. Young people across Britain were struggling with unprecedented levels of anxiety, depression, and social isolation, yet many felt too ashamed or frightened to seek help. As she prepared for the day ahead, Catherine's mind wandered to a particular encounter that had crystallized her decision. During a visit to a secondary school in Manchester 3 months earlier, she had met Sarah, a 15-year-old girl who had been referred to the school's counseling service after months of declining academic performance and social withdrawal. Sarah's story was heartbreakingly common. She had been struggling with anxiety and depression for over a year, but fear of being labeled as weak or attention-seeking had prevented her from reaching out for help. What struck Catherine most profoundly was Sarah's question at the end of their conversation. "Do you ever feel scared or worried about things, Your Royal Highness? Because everyone always says you have such a perfect life." The innocent directness of the question had caught Catherine off guard. In that moment, she realized how the carefully maintained image of royal perfection might be contributing to the very stigma that prevented young people like Sarah from seeking the support they desperately needed. The morning progressed with the usual pre-event preparations. Catherine's dresser helped her select an outfit that would strike the right tone. Professional yet approachable, formal enough to maintain dignity, but not so elaborate as to create distance from her audience. She chose a navy blue dress with simple lines, paired with minimal jewelry. Every detail was considered, as she knew that in her position, appearance often spoke as loudly as words. Her husband, William, stopped by her study before leaving for his own engagements. "I'm proud of you for doing this," he said, placing a supportive hand on her shoulder. "It takes courage to use your platform in a new way, especially when you know it might ruffle some feathers in certain circles." Catherine nodded, appreciating his support while also acknowledging the truth in his words. She knew that some members of the establishment would view her planned speech as stepping outside traditional royal bounds. The monarchy had survived for centuries by maintaining careful neutrality on social and political issues, speaking through actions and patronages rather than direct advocacy. But Catherine had come to believe that some issues transcended traditional protocol, that her unique position came with both privilege and responsibility. The drive to the venue, a community center in South London that specialized in youth mental health services, gave Catherine time for final reflection. She watched the familiar streets of London pass by the window, thinking about the countless young people in those neighborhoods who might be struggling in silence. The community center had been chosen deliberately. It represented the grassroots level where real change happened, far from the gilded halls of traditional royal venues. Upon arrival, Catherine was greeted by Dr. Amanda Foster, the center's director, who had become a trusted advisor in Catherine's growing understanding of mental health issues. Dr. Foster had been instrumental in helping the princess understand the complex web of factors contributing to the youth mental health crisis: social media pressures, academic stress, economic uncertainty, and the lingering effects of the pandemic years. "Thank you for choosing our center for this announcement," Dr. Foster said as they walked through the facility. "Having your voice added to this conversation could make a real difference. Young people listen to you in ways they might not listen to traditional authority figures." As they toured the center, Catherine met with some of the young people who used its services. Their stories reinforced her conviction that speaking out was not just appropriate, but necessary. Michael, a 17-year-old who had struggled with depression after his parents' divorce, told her how he had hidden his feelings for months because he thought seeking help would disappoint his family. Emma, a 16-year-old dealing with social anxiety, described how she had nearly dropped out of school before finding support at the center. "The hardest part wasn't the feelings themselves," Emma explained. "It was feeling like I wasn't allowed to have them, like admitting I was struggling meant I was weak or ungrateful for the good things in my life." These conversations strengthened Catherine's resolve as she prepared for the media gathering that would take place in the center's main hall. Representatives from major news outlets, mental health organizations, and youth advocacy groups had assembled to hear her speak. The informal setting was intentional. Catherine wanted this message to feel accessible and genuine rather than delivered from an ivory tower. As she stood before the gathered audience, Catherine felt the weight of the moment. She was about to step into uncharted territory, using her platform in a way that challenged traditional royal protocol. But she was also stepping into her own power as someone who could effect real change on an issue that mattered deeply to her and to millions of young people across the country. "Good morning, everyone," she began, her voice steady despite the butterflies in her stomach. "I want to start by thanking Dr. Foster and the team here at the South London Youth Mental Health Center for hosting us today. This center represents something vital, a place where young people can find support without judgment, where they can begin to heal and grow." She paused, looking around the room at the faces watching her intently. "I'm here today not just as the Princess of Wales, but as a mother, as someone who cares deeply about the well-being of young people, and as someone who believes we need to have honest conversations about mental health." The room was quiet, everyone sensing that something significant was about to unfold. Catherine continued, her words carefully chosen, but delivered with genuine emotion. "For too long, we've allowed stigma and shame to prevent young people from seeking the help they need and deserve. We've maintained a culture where admitting struggle is seen as weakness rather than courage, where asking for help is viewed as failure rather than wisdom." As she spoke, Catherine could see the impact of her words on the faces before her. Some audience members were taking notes furiously, others were nodding in agreement, and a few appeared surprised by the directness of her approach. She knew she was breaking new ground, not just for herself, but for the royal family's approach to social issues. "I want to share something personal with you today," Catherine continued, feeling her heart rate increase as she prepared to reveal more of herself than royal protocol typically allowed. "Like many of you, I have experienced moments of doubt, anxiety, and overwhelming pressure. The difference is that my struggles have often been dismissed or overlooked because of assumptions about privilege and perfect lives." The admission sent a ripple of attention through the room. Catherine was acknowledging her own vulnerability in a way that few members of the royal family had ever done publicly. She was humanizing herself in service of a greater cause, using her own experience to break down the barriers that prevented others from seeking help. When I became a mother, she went on, I experienced the same fears and anxieties that many new parents face. I worried constantly about whether I was doing everything right, whether I was enough for my children, whether I could live up to the expectations placed upon me. But I was fortunate to have support systems and resources that many people don't have access to. Catherine's voice grew stronger as she found her rhythm, her nervousness transforming into passion for the subject. This privilege comes with responsibility. If I can use my position to help even one young person feel less alone in their struggles, then I must do so. If I can help normalize conversations about mental health, then that becomes part of my duty. She went on to outline specific initiatives she planned to support, partnerships with mental health organizations, and changes she hoped to see in how society approached youth mental wellness. But the heart of her message remained personal, an acknowledgement that everyone, regardless of their circumstances, deserve compassion and support when facing mental health challenges. As Catherine concluded her prepared remarks, she opened the floor for questions. The first came from a journalist representing a major newspaper. Your Royal Highness, some might argue that speaking so personally about these issues goes beyond traditional royal protocol. How do you respond to that criticism? Catherine had anticipated this question and had spent considerable time thinking about her response. I understand that concern, she replied thoughtfully. The royal family has always served the British people, and sometimes that service evolves to meet the needs of our time. Right now, young people are facing a mental health crisis that requires all of us to step up in whatever way we can. If my speaking out helps reduce stigma and encourages even one person to seek help, then I believe I'm fulfilling my duty to serve. The questions continued, each one probing different aspects of her decision to speak out so directly. Catherine answered each with care, clearly articulated her reasoning, and demonstrated the depth of preparation she had undertaken. It was clear that this was not an impulsive decision, but a carefully considered step based on extensive research and genuine conviction. As the formal session concluded, Catherine spent additional time speaking individually with young people who use the center's services. These conversations, away from the cameras and journalists, reminded her why she had chosen to take this step. The gratitude in their eyes, their relief at hearing someone in her position acknowledge the reality of mental health struggles, validated every moment of uncertainty she had experienced in preparing for this day. The drive back to Kensington Palace was quiet, giving Catherine time to process what had just occurred. She had crossed a threshold, using her platform in a new way that would undoubtedly generate discussion, debate, and possibly criticism. But she felt a sense of peace about the decision, knowing that she had acted from a place of genuine conviction rather than calculated public relations strategy. James, who had observed the entire event, finally broke the silence. I think you started something important today, Your Royal Highness. The response from the young people, especially, was remarkable. Catherine smiled, still feeling the emotional weight of the morning's encounters. I hope so, James. I hope this is just the beginning of a larger conversation that needed to happen. As they approached the palace, Catherine's phone buzzed with messages from family members and close advisors who had been monitoring news coverage of her speech. The initial reaction seemed positive, with mental health advocates praising her courage and several news outlets highlighting the significance of her personal disclosures. But Catherine knew that the real measure of success wouldn't be found in news coverage or social media reactions. It would be measured in whether her words reached young people who were struggling in silence, whether her example gave others permission to seek help, and whether her use of royal privilege in service of this cause would inspire broader societal change. The rest of the day would bring meetings with palace staff to discuss follow-up initiatives, calls with mental health organizations eager to collaborate, and preparations for what she sensed would be increased scrutiny of her future public statements. She had opened a door that couldn't be easily closed, committed herself to a level of advocacy that went beyond traditional royal bounds. As she settled back in her study that evening, surrounded by the same papers that had held her attention that morning, Catherine reflected on how much had changed in just one day. She had found her voice on an issue that mattered deeply to her, and, in doing so, had perhaps redefined what it meant to use royal privilege responsibly in the modern era. The reaction to Catherine's speech rippled through British society with unexpected intensity. Within hours of her appearance at the South London Youth Mental Health Centre, social media platforms buzzed with discussion, news outlets ran analysis pieces, and mental health organizations reported surges in calls to their helplines. The princess had clearly touched something deeper than anyone had anticipated. In the days following her announcement, Catherine found herself at the center of a national conversation that extended far beyond the usual royal coverage. Young people across the country began sharing their own stories using hashtags that emerged organically from social media discussions. Mental health advocates praised her courage, while some traditionalists questioned whether she had overstepped royal boundaries. The response was exactly what Catherine had expected: mixed, passionate, and impossible to ignore. Dr. Amanda Foster called the palace 3 days after the speech with remarkable news. "Your Royal Highness, I wanted you to know that we've had over 300 young people contact our center since your visit. Many of them specifically mentioned feeling encouraged to reach out after hearing you speak so openly about your own experiences." Catherine felt a surge of validation mixed with humility. The numbers represented real people making difficult decisions to seek help, potentially changing the trajectory of their lives. But she also understood that her speech was just the beginning. Creating lasting change would require sustained effort, careful planning, and continued willingness to push beyond traditional royal comfort zones. The palace communications team, led by seasoned media professional Sarah Jenkins, had been working overtime to manage the unprecedented response. "We're receiving interview requests from outlets across the globe," Sarah reported during their morning briefing. "Everyone wants to know whether this represents a new direction for the royal family's approach to social issues." Catherine had been thinking about exactly that question. Her speech hadn't been intended as a wholesale change in royal protocol, but she recognized that it had created expectations for continued advocacy. The challenge now was determining how to build on the initial impact without compromising the dignity and effectiveness of the monarchy. "I think we need to be strategic about next steps," Catherine replied thoughtfully. "This can't become about me or about generating headlines. It needs to remain focused on helping young people and changing how society approaches mental health." Over the following week, Catherine threw herself into understanding the broader landscape of youth mental health services across Britain. She arranged private meetings with leading researchers, policymakers, and practitioners, each conversation adding layers to her understanding of the systemic challenges that needed to be addressed. Dr. Rachel Morrison, a child psychologist at Great Ormond Street Hospital, provided particularly sobering insights during their meeting. The demand for youth mental health services has increased by over 60% in the past 5 years, but funding and resources haven't kept pace. We're seeing young people wait months for appointments, often reaching crisis points before they can access proper support. Catherine took detailed notes, asking probing questions about everything from training requirements for mental health professionals to the role of schools in early identification of struggling students. She was determined to move beyond symbolic gestures toward understanding concrete steps that could make a meaningful difference. The meeting that proved most challenging took place with Sir Reginald Hartwell, a longtime advisor to the royal family who had served multiple generations of the Windsor line. His concerns reflected those of more traditional palace voices who worried about the precedent Catherine's speech might have set. "Your Royal Highness, I deeply admire your commitment to this cause," Sir Reginald began carefully. "However, I must express some concern about the potential implications of such personal disclosure in public settings. The monarchy has traditionally maintained dignity through a certain reserve, allowing our actions to speak rather than our words." Catherine had anticipated this conversation and had prepared her response. "I understand your concerns, Sir Reginald, and I don't take them lightly. But I believe we must also consider the changing nature of public service in the modern era. Young people today respond to authenticity and connection in ways that previous generations might not have. If we can't evolve to meet the needs of the people we serve, we risk becoming irrelevant. The discussion that followed was respectful, but firm on both sides. Sir Reginald articulated legitimate concerns about maintaining royal dignity and the potential for personal disclosure to be misinterpreted or exploited. Catherine acknowledged these risks while maintaining her conviction that the mental health crisis required a response that transcended traditional protocol. Perhaps, Catherine suggested, we can find ways to maintain dignity while still being more open about issues that affect millions of our citizens. The goal isn't to abandon royal tradition, but to ensure that tradition serves the people rather than constraining our ability to help them. Meanwhile, responses from young people continued to pour in through various channels. The palace had established a dedicated email address for mental health-related correspondence, and Catherine insisted on reading a selection of the messages personally. Each letter reinforced her belief that speaking out had been the right decision. 16-year-old Katie from Liverpool wrote, "I never thought someone like you could understand what it feels like to be anxious and worried all the time. Hearing you talk about your own struggles made me realize it's okay to ask for help. I'm finally going to talk to my parents about seeing a counselor." 18-year-old Marcus from Birmingham shared, "I was planning to quit college because I couldn't handle the pressure and didn't want anyone to know I was struggling. Your speech made me realize that asking for support isn't giving up. It's being smart about taking care of myself." These letters became Catherine's daily motivation, reminding her that behind every statistic about youth mental health was a real person making difficult decisions about their well-being. She began carrying a few of the most moving letters with her to official engagements, reading them before appearances as a reminder of why her advocacy mattered. The international response to Catherine's speech also surprised palace observers. Mental health advocates from countries around the world reached out to express support and share their own challenges. Dr. Jennifer Walsh from a youth mental health organization in Australia wrote, "Your willingness to speak personally about these issues has given advocates here new language for discussing the importance of reducing stigma. You've shown that seeking help and admitting vulnerability can be acts of strength." Catherine began to understand that her platform extended far beyond Britain, that her words carried weight in global conversations about mental health, youth welfare, and the role of public figures in addressing social issues. This realization brought both opportunity and responsibility, expanding the potential impact of her advocacy while also increasing the pressure to use her voice effectively. 3 weeks after her initial speech, Catherine made another significant decision. She would establish a new initiative within her existing charitable work, specifically focused on youth mental health advocacy and support. The program would include partnerships with existing organizations, funding for research and services, and, most importantly, a commitment to continued public discussion of mental health issues. The announcement of the Royal Foundation's Youth Mental Health Initiative came during a visit to a school in Manchester, the same city where Catherine had met Sarah, the young woman whose question had catalyzed her decision to speak out. Sarah was invited to attend the announcement, and her presence served as a powerful reminder of why the initiative mattered. This isn't just about providing funding or creating new programs, Catherine explained to the assembled students and staff. It's about changing the conversation around mental health, making it as normal to talk about anxiety or depression as it is to discuss a broken arm or physical illness. She continued, looking directly at the young faces in the audience. "I want you to know that struggling with mental health doesn't make you weak, broken, or inadequate. It makes you human. And being human means sometimes needing help, support, and understanding from others." The initiative's launch included several concrete commitments: funding for research into early intervention strategies, support for training programs for teachers and youth workers, partnerships with technology companies to develop mental health resources for young people, and, perhaps most significantly, a commitment from Catherine to continue speaking openly about these issues. Dr. Foster, who had become an unofficial advisor to Catherine's mental health advocacy, attended the launch and was struck by the evolution she had witnessed. 3 weeks ago, she was nervous about stepping outside traditional boundaries, Dr. Foster observed to a colleague. Today, she's confidently articulating a comprehensive approach to systemic change. She's found her voice. The school visit also provided Catherine with an opportunity to address some of the criticism her advocacy had generated. During a question-and-answer session with older students, one young man asked directly, "Some people say you shouldn't talk about personal stuff because you're royal. What do you think about that?" Catherine smiled at the directness of the question, appreciating the opportunity to address the issue head-on. "That's a fair question, and it's something I've thought about a lot. I believe being royal means serving the people of this country, and sometimes that service requires doing things differently than they've been done before. If talking about my own experiences helps even one person feel less alone or more willing to seek help, then I think that's exactly what I should be doing." The response from students was immediate and positive, with several nodding in agreement and one young woman calling out, "Thank you for being real with us." As Catherine left the school that day, she reflected on how much had changed since her initial decision to speak out. What had begun as a single speech about mental health stigma had evolved into a comprehensive advocacy platform that was reshaping both her public role and the royal family's approach to social issues. The drive back to London provided time for Catherine to review briefing materials for her next engagement, a meeting with parliamentary members who were working on mental health legislation. Her advocacy had opened doors to policy discussions that might not have been available to her before, creating opportunities to influence systemic change beyond awareness raising. James, reviewing the day's events, remarked, "The response from young people continues to be remarkable. I think you've tapped into something that was waiting for someone to give voice to it." Catherine nodded, but her expression remained thoughtful. "The challenge now is maintaining momentum while ensuring we're actually creating change rather than just generating conversation. Young people deserve more than good intentions and inspiring speeches. They deserve real resources and systemic support." That evening, Catherine spent time in her study reviewing research reports and policy proposals related to youth mental health. The work had become genuinely absorbing, connecting her natural empathy with intellectual challenge and meaningful purpose. She was discovering that effective advocacy required not just passion, but deep understanding of complex issues, strategic thinking about how to create change, and persistence in the face of inevitable obstacles. As she prepared for the next phase of her advocacy work, Catherine felt a sense of clarity about her role that had been absent before her decision to speak out. She had found a way to use her unique platform that felt authentic, meaningful, and aligned with her values. The path ahead would require continued courage, strategic thinking, and willingness to challenge traditional boundaries, but she was committed to the journey. 2 months after Catherine's groundbreaking speech, the impact of her advocacy was being felt across multiple levels of British society. Schools were reporting increased requests for mental health support. Young people were engaging more openly with counseling services, and the national conversation about youth well-being had shifted dramatically. However, with this success came new challenges that Catherine hadn't fully anticipated. The most unexpected development was the intense personal scrutiny that accompanied her mental health advocacy. Media outlets began analyzing every aspect of her public appearances, looking for signs of the anxiety and pressure she had acknowledged experiencing. Paparazzi photographers seemed more aggressive in their attempts to capture unflattering images, as if trying to document evidence of her admitted vulnerability. "It's become quite a paradox," Catherine confided to her close friend Sophie, Countess of Wessex, during a private lunch at Kensington Palace. "Speaking about mental health to help reduce stigma has somehow made me more vulnerable to exactly the kind of scrutiny that can damage mental health." Sophie, who had navigated her own challenges with royal life and public expectations, offered understanding and perspective. "You knew this might happen when you decided to be more open. The question is whether you still believe it was worth it, despite the increased pressure." Catherine considered the question seriously. Despite the additional scrutiny, letters from young people continued to arrive daily, sharing stories of how her advocacy had encouraged them to seek help or speak up about their struggles. Mental health organizations reported sustained increases in young people accessing services. The Youth Mental Health Initiative had received overwhelming support from donors and volunteers. The positive impact was undeniable, even if it came with personal costs. "I do think it's worth it," Catherine finally replied. "But I'm learning that advocacy requires a different kind of resilience than traditional royal duties. You have to be prepared to have your own struggles magnified and questioned while you're trying to help others with theirs." The challenge became more acute when Catherine received criticism from an unexpected source. Dr. Margaret Thornfield, a prominent child psychiatrist, published an article questioning whether Catherine's public discussions of her own mental health experiences might actually discourage young people from seeking professional help. While the princess's intentions are clearly admirable, Dr. Thornfield wrote, "There's a risk that her ability to cope with pressure while maintaining her public role might give young people unrealistic expectations about their own resilience." Mental health struggles are medical issues that require professional intervention, not just inspirational speeches from privileged individuals. The criticism stung because it came from someone Catherine respected and because it touched on her own insecurities about whether her advocacy was truly helpful or merely well-intentioned. She requested a meeting with Dr. Thornfield to discuss the concerns directly, demonstrating the thoughtful approach she had developed toward constructive criticism. Their conversation, held at Dr. Thornfield's clinic in Edinburgh, proved to be one of the most challenging and educational exchanges Catherine had experienced since beginning her advocacy work. Dr. Thornfield didn't soften her concerns out of deference to Catherine's royal status, instead engaging her as a fellow advocate for youth mental health. "My concern," Dr. Thornfield explained, "is that when someone in your position speaks about overcoming mental health challenges, it might inadvertently suggest that willpower and positive thinking are sufficient solutions. Many young people need medication, intensive therapy, or other professional interventions that can't be replaced by inspirational messaging." Catherine listened carefully, taking notes and asking clarifying questions. She realized that Dr. Thornfield was raising legitimate concerns about the complexity of mental health treatment and the potential for even well-meaning advocacy to oversimplify serious medical issues. "How do you think I could better balance sharing my own experiences with emphasizing the importance of professional help?" Catherine asked. "I never want my advocacy to discourage anyone from seeking proper medical support." The discussion that followed helped Catherine refine her approach to public speaking about mental health. She learned to be more explicit about the professional support she had received, to emphasize the medical nature of mental health conditions, and to always include information about how young people could access proper care when she shared her personal experiences. Dr. Thornfield, impressed by Catherine's willingness to engage with criticism and adjust her approach, became an unofficial advisor to the Youth Mental Health Initiative. "Your openness to feedback shows exactly the kind of thoughtfulness that effective advocacy requires," she told Catherine as their meeting concluded. The encounter with Dr. Thornfield marked a turning point in Catherine's advocacy style. She became more nuanced in her public statements, more careful to emphasize the complexity of mental health issues, and more explicit about directing people toward professional resources. Rather than viewing the criticism as a setback, she used it as an opportunity to become a more effective advocate. This evolution was evident during her next major public appearance, a speech at the Royal College of Psychiatrists' annual conference. Catherine had been invited to address mental health professionals, an audience that would evaluate her advocacy from a clinical perspective. The invitation represented recognition of her growing credibility in the field, but also presented new challenges in terms of striking the right tone and demonstrating genuine understanding of complex issues. "I'm honored to speak to professionals who dedicate their careers to understanding and treating mental health conditions," Catherine began her address. "As someone who advocates for increased awareness and reduced stigma, I want to acknowledge that awareness alone is not treatment, and that personal stories, while important for reducing shame, cannot replace professional medical care." She went on to describe how her own experiences had led her to seek professional support, emphasizing the importance of therapy, the value of medical expertise, and the complex nature of mental health treatment. The speech demonstrated remarkable growth in her understanding of the field and her ability to communicate about mental health issues with nuance and precision. Dr. Patricia Reynolds, the conference organizer, later commented, "The princess showed impressive evolution in her approach. She's clearly been listening to feedback and working to understand the clinical complexities of mental health. That kind of humility and willingness to learn makes her a much more effective advocate." The professional recognition Catherine received from the psychiatric community opened new doors for her advocacy work. She was invited to participate in research advisory committees, to contribute to policy discussions at the highest levels of government, and to collaborate with international organizations working on youth mental health initiatives. One particularly meaningful opportunity came when the World Health Organization invited Catherine to participate in a global summit on youth mental health. The invitation recognized her advocacy as part of an international movement to address what had become a worldwide crisis affecting young people across all cultures and economic levels. Preparing for the WHO Summit required Catherine to expand her understanding beyond British context to consider global perspectives on youth mental health. She spent weeks reviewing research from different countries, speaking with international advocates, and learning about cultural variations in how mental health issues were understood and addressed. The summit, held in Geneva, brought together advocates, policymakers, researchers, and young people from around the world. Catherine's participation alongside other global leaders in mental health advocacy marked her emergence as an international voice on the issue, not just a British royal speaking about local concerns. During her presentation to the summit, Catherine shared insights from her advocacy work in Britain while acknowledging the global scope of youth mental health challenges. "We've learned that young people everywhere face similar pressures, but they also need culturally appropriate and locally accessible solutions," she explained. Effective advocacy requires understanding both universal human experiences and specific community needs. The international exposure brought new perspectives that enriched Catherine's domestic advocacy work. She learned about innovative approaches to youth mental health support from countries with different healthcare systems, different cultural attitudes toward mental health, and different resources for addressing these challenges. Returning from Geneva, Catherine was energized by new ideas but also aware of the increasing complexity of her advocacy role. She was no longer simply a royal patron supporting a cause. She had become a recognized expert in youth mental health advocacy with international credibility and corresponding responsibilities. The demands of this expanded role required adjustments to her other royal duties and personal life. Catherine worked with palace staff to restructure her schedule, ensuring adequate time for the research, preparation, and relationship building that effective advocacy required while maintaining her other responsibilities as Princess of Wales. William proved to be a crucial support during this transition, encouraging her advocacy work while helping her maintain perspective on family priorities. "You found something that genuinely matters to you and where you can make a real difference," he told her. "But remember that you can't solve every problem or help every person. You need to pace yourself for the long term." The wisdom of his advice became clear when Catherine received a letter from a young man named David, whose sister had died by suicide despite receiving mental health treatment. David wrote to express both gratitude for Catherine's advocacy and frustration with the limitations of available support systems. "Thank you for speaking up about mental health," David wrote. "But I need you to know that awareness and reduced stigma aren't enough when the services aren't there to help people who reach out. My sister asked for help, but she couldn't get the intensive support she needed quickly enough." The letter forced Catherine to confront the limitations of awareness-focused advocacy and the need for systemic change in service delivery, funding, and treatment approaches. She realized that her role needed to evolve again, moving beyond inspiring speeches toward addressing the structural barriers that prevented young people from receiving adequate care. This realization led to Catherine's decision to focus the next phase of her advocacy on policy change and system improvement. She began working more closely with parliamentarians, health service administrators, and policy researchers to understand how structural changes could complement awareness-raising efforts. The transition from inspirational advocacy to policy-focused work required new skills and different types of preparation. Catherine enrolled in a series of private tutorials with health policy experts, learning about healthcare financing, service delivery models, and the complex political factors that influenced mental health policy decisions. She's become genuinely sophisticated in her understanding of these issues, observed Dr. Michael Harrison, a health policy researcher who worked with Catherine on developing policy proposals. She's moved far beyond symbolic advocacy toward understanding how systems actually function and how they can be changed. As Catherine's third month of intensive advocacy work concluded, she found herself transformed not just as a public figure, but as a person. The work had challenged her intellectually, emotionally, and professionally in ways that traditional royal duties never had. She had discovered capabilities she hadn't known she possessed and developed expertise in areas far beyond her original interests. 6 months after Catherine's initial speech about mental health, her advocacy had evolved into something far more comprehensive and sophisticated than anyone had anticipated. What began as a personal decision to speak openly about youth mental health had developed into a multifaceted initiative that was influencing policy at the highest levels of government and inspiring similar movements in other countries. The transformation was evident in Catherine's daily schedule, which now included regular meetings with cabinet ministers, briefings with health service administrators, and strategy sessions with international mental health organizations. Her private study at Kensington Palace had been reorganized to accommodate research materials, policy documents, and correspondence related to her advocacy work, reflecting how central this cause had become to her royal role. The most significant development came when Catherine received an invitation from the Prime Minister to participate in a special government task force on youth mental health policy. The invitation represented unprecedented integration of royal advocacy with government policy-making, breaking traditional boundaries between ceremonial royal duties and active participation in policy development. "This is quite extraordinary," commented Professor Elizabeth Warner, a constitutional expert who had studied royal roles for decades. "We're seeing the evolution of royal service in real time, with the Princess of Wales using her platform not just to raise awareness, but to actively participate in creating solutions." Catherine approached the task force opportunity with characteristic thoroughness, spending weeks preparing by consulting with experts, reviewing international best practices, and developing specific policy recommendations based on her months of advocacy experience. She was determined to contribute meaningfully to the discussions rather than serving as a symbolic presence. The first task force meeting took place at 10 Downing Street, bringing together cabinet ministers, senior civil servants, mental health experts, and representatives from youth organizations. Catherine's presence at the table alongside government officials marked a new model of royal engagement with public policy issues. During the meeting, Catherine presented a comprehensive analysis of gaps in current youth mental health services, drawing on research she had conducted and insights gained from her extensive work with young people and mental health organizations. Her presentation surprised government officials with its depth and specificity. "Your Royal Highness has identified systemic issues that we've been struggling to address for years," acknowledged Health Secretary Robert Matthews. "Having someone with your platform and access willing to focus sustained attention on these problems could be transformative." Catherine's participation in the task force required careful navigation of constitutional boundaries. Working closely with constitutional experts and palace advisors, she developed an approach that allowed her to contribute expertise and advocacy while avoiding partisan political positions that would be inappropriate for a member of the royal family. "I'm here to represent the voices of young people who have shared their experiences with me," Catherine explained to the task force. "My role is to ensure that policy discussions include the perspectives of those most affected by these issues, not to advocate for particular political solutions." This nuanced approach allowed Catherine to make substantive contributions while maintaining constitutional propriety. She became particularly effective at highlighting the human impact of policy decisions and ensuring that young people's perspectives were central to task force deliberations. The work was intellectually demanding in ways that challenged Catherine to grow beyond her previous experience. She found herself studying complex healthcare economics, analyzing research on early intervention strategies, and learning to communicate with policymakers who thought in terms of budgets, timelines, and legislative processes. She's developed remarkable fluency in policy language while maintaining her ability to connect issues to human stories, observed Dr. Sarah Chun, a task force member who had initially been skeptical about royal participation in policy work. She brings a unique perspective that combines high-level access with grassroots understanding. One of Catherine's most significant contributions to the task force was her proposal for a comprehensive early intervention program in schools. Drawing on her visits to educational institutions across the country, she had identified patterns in how mental health issues developed and opportunities for prevention that weren't being addressed by existing services. We keep waiting until young people are in crisis before providing support, Catherine argued during one task force meeting. But the young people I've spoken with often describe warning signs and early struggles that went unnoticed or unaddressed for months. We need systems that can identify and respond to these early indicators. Her proposal included training for teachers and school staff, embedded mental health professionals in educational settings, peer support programs, and family engagement strategies. The comprehensive approach reflected months of research and consultation with educational and mental health experts. The proposal gained support from task force members and was eventually incorporated into a broader government initiative for youth mental health service reform. Seeing her research and advocacy translated into concrete policy changes provided Catherine with profound satisfaction and validation of her approach to royal service. However, the increased policy role also brought new challenges and criticisms. Some constitutional purists argue that Catherine's direct involvement in government policy development crossed traditional lines between royal ceremonial duties and political activity. Media coverage became more scrutinizing, with some commentators questioning whether her advocacy had evolved beyond appropriate royal bounds. The criticism reached a peak when opposition leader Janet Morrison publicly questioned Catherine's role during a parliamentary debate on mental health funding. While we welcome royal interest in important social issues, Morrison stated, we must be careful not to blur the lines between ceremonial monarchy and active participation in government policymaking. The parliamentary criticism created a political challenge for Catherine's advocacy work and forced palace officials to carefully consider how to respond. After extensive consultation with constitutional experts, Catherine made the decision to address the concerns directly through a carefully crafted public statement. I understand the importance of maintaining appropriate constitutional boundaries, Catherine's statement read. My participation in policy discussions is focused on ensuring that the voices and experiences of young people are heard by decision-makers. I do not advocate for partisan political positions, but rather for evidence-based approaches to addressing the mental health crisis affecting our young people. The statement struck a careful balance, acknowledging constitutional concerns while defending the value of her contributions to policy development. It also demonstrated Catherine's growing sophistication in navigating complex political and constitutional issues that arose from her expanded advocacy role. Support for Catherine's approach came from unexpected sources, including several members of Parliament from different political parties who had observed her contributions to policy discussions. Conservative MP Rachel Thompson stated, "The Princess of Wales brings a unique perspective that enhances policy development without crossing into partisan politics. Her focus on evidence and young people's experiences is exactly what good policymaking requires." Labour MP David Singh added, "Constitutional boundaries are important, but so is effective governance." If royal advocacy can help us develop better policies for young people's mental health, then we should welcome that contribution while maintaining appropriate oversight. The political debate ultimately strengthened Catherine's position by forcing a public discussion of her role and generating broad support for her approach from across the political spectrum. It also led to the development of clearer guidelines for royal participation in policy development, creating a framework that could guide future advocacy work. Meanwhile, the practical impact of Catherine's advocacy continued to expand. The Youth Mental Health Initiative had grown into a major charitable organization with dedicated staff, significant funding, and partnerships with organizations across the country. Schools reported increased engagement with mental health support services, and young people's organizations documented reduced stigma around seeking help. Perhaps most significantly, Catherine's advocacy had inspired other members of the royal family to take more active approaches to their charitable work. Prince William expanded his mental health advocacy to include more direct policy engagement, while other royal family members began speaking more personally about social issues they supported. She's changed the template for how modern royals can serve, observed royal historian Dr. Amanda Phillips. The traditional model of ribbon cutting and patronage announcements is evolving toward more substantive engagement with complex social issues. The international dimension of Catherine's work also continued to expand. She was invited to speak at conferences in multiple countries, consulted by international organizations developing youth mental health initiatives, and recognized as a leading voice in global conversations about these issues. During a visit to Canada focused on youth mental health policy, Catherine met with government officials, mental health professionals, and young people to learn about different approaches to addressing similar challenges. The visit demonstrated how her advocacy had created opportunities for international collaboration and knowledge sharing. Your work in Britain has inspired similar initiatives here, Canadian Health Minister Patricia Wong told Catherine during their meeting. Having someone with your platform speaking so openly about these issues has helped reduce stigma and increase political support for policy changes. As Catherine reflected on the 6 months since her initial decision to speak out, she was struck by how dramatically both her role and her understanding of complex social issues had evolved. What had begun as a personal conviction about the need to address youth mental health had developed into comprehensive expertise in policy development, international advocacy, and systemic change strategies. The work had also changed her relationship with her royal duties more broadly. Traditional engagements now felt more meaningful because they connected to deeper purposes and substantive work. Ceremonial appearances became opportunities to gather information, build relationships, and advance advocacy goals rather than simply fulfilling protocol requirements. I feel like I found a way to use this platform that feels authentic and impactful, Catherine confided to William during one of their evening walks through Kensington Palace Gardens. The work is challenging and sometimes controversial, but it's the most meaningful thing I've ever done. William's response reflected his understanding of how the advocacy work had transformed his wife's approach to royal service. You've shown that being royal doesn't mean being passive about issues you care about. You found a way to serve that's both respectful of tradition and responsive to contemporary needs. As Catherine prepared for the next phase of her advocacy work, which would include the launch of new policy initiatives and expanded international collaboration, she felt a deep sense of purpose and direction that had been missing from her earlier royal experiences. She had discovered that effective service required more than good intentions or ceremonial appearances. It demanded sustained commitment, continuous learning, and willingness to navigate complex challenges in pursuit of meaningful change. 1 year after Catherine's groundbreaking speech at the South London Youth Mental Health Centre, the transformation in both her personal role and the broader conversation about youth mental health had exceeded everyone's expectations. What had begun as a single moment of courage had evolved into a comprehensive movement that was reshaping how British society approached mental health, how the royal family engaged with social issues, and how young people understood their own worth and potential. The anniversary provided an opportunity for reflection and assessment that Catherine approached with characteristic thoroughness. She commissioned an independent evaluation of the Youth Mental Health Initiative's impact, wanting objective data about whether her advocacy had produced meaningful change beyond awareness raising and positive media coverage. The results were remarkable. Mental health services across the country reported sustained increases in young people seeking help, with many specifically mentioning Catherine's advocacy as reducing their reluctance to reach out for support. Schools implementing the early intervention programs Catherine had championed showed significant improvements in student well-being and academic engagement. Most importantly, preliminary data suggested reductions in youth suicide rates in areas where comprehensive support programs had been implemented. The numbers tell a compelling story, explained Dr. Robert Chun, the independent researcher who led the evaluation. We can trace direct connections between the princess's advocacy work and measurable improvements in young people's access to mental health support and their willingness to seek help when they need it. However, the evaluation also identified areas where progress remained frustratingly slow. Despite increased awareness and policy commitments, many young people still faced lengthy waits for specialized treatment. Funding for mental health services remained inadequate compared to the scale of need. Geographic disparities meant that young people in rural or economically disadvantaged areas had significantly less access to quality support. Catherine used these findings to refine her advocacy strategy for the initiative's second year. Rather than continuing to focus primarily on awareness raising, she decided to concentrate on addressing the structural barriers that prevented young people from receiving timely, effective care. This shift required another evolution in Catherine's approach to royal service. She began working more closely with healthcare administrators, local government officials, and community organizations to understand how services could be improved at the operational level. The work was less glamorous than international conferences or high-profile speeches, but Catherine had learned that sustainable change often happened through unglamorous administrative improvements and bureaucratic reforms. One of her most significant projects involved working with the National Health Service to redesign how young people accessed mental health services. Traditional models required referrals from family doctors, often creating delays and barriers that discouraged young people from seeking help. Catherine advocated for direct access programs that would allow young people to connect with mental health support without navigating complex referral systems. We need services that work the way young people live, Catherine argued during a meeting with NHS administrators. If a teenager is in crisis at 2 a.m. on a weekend, they need to be able to reach someone immediately, not wait for an appointment with their GP the following week. The advocacy work required Catherine to master complex details about healthcare delivery, insurance systems, and government procurement processes. She spent hours studying budget documents, service delivery models, and quality metrics, developing expertise that surprised even veteran healthcare administrators. She asks incredibly sophisticated questions about resource allocation and service integration, noted Dr. Helen Morrison, an NHS regional director who worked closely with Catherine on service redesign projects. She understands these systems better than most politicians who have oversight responsibility for healthcare. The technical knowledge Catherine developed proved crucial when she was invited to testify before a parliamentary select committee investigating youth mental health services. Her testimony combined personal advocacy with detailed policy analysis, demonstrating how her role had evolved far beyond traditional royal ceremonial functions. The current system creates barriers precisely where we need to eliminate them, Catherine told the committee. Young people facing mental health crises shouldn't have to navigate bureaucratic mazes to access support. We need services that are designed around their needs rather than administrative convenience. Her testimony included specific recommendations for legislative changes, funding priorities, and service delivery reforms. The committee's subsequent report incorporated many of Catherine's suggestions and credited her advocacy with highlighting critical gaps in existing services. The parliamentary testimony marked another milestone in Catherine's evolution as an advocate and public figure. She had demonstrated ability to engage with complex policy issues at the highest levels of government, while maintaining her focus on the human impact of systemic problems. However, the expanded role also brought personal challenges that Catherine had to navigate carefully. The intensity of her advocacy work sometimes conflicted with family responsibilities and other royal duties. Managing multiple complex initiatives while maintaining her roles as wife and mother required careful balance and strong support systems. There are days when I feel pulled in too many directions, Catherine admitted to her close friend and advisor, Lady Sarah Chatto, during a rare private lunch. I want to be present for my children and supportive of William's work, but I also feel responsibility to the young people who trust me to advocate for them. Lady Sarah, who had observed royal life across multiple generations, offered perspective based on long experience with balancing public service and personal priorities. You found work that genuinely matters to you, which is a gift many people never receive. The challenge is ensuring that the work serves your values rather than consuming your life. The conversation helped Catherine develop better boundaries around her advocacy work and more sustainable approaches to managing competing demands. She established clearer divisions between work time and family time, delegated more responsibilities to the growing team supporting the Youth Mental Health Initiative, and became more strategic about which opportunities she accepted. These adjustments proved crucial as international interest in Catherine's advocacy approach continued to expand. She received invitations to advise governments in multiple countries on youth mental health policy, to speak at major international conferences, and to collaborate with global organizations addressing similar challenges. The most significant international opportunity came when Catherine was invited to join the United Nations Special Commission on Youth Mental Health, a newly formed body tasked with developing global strategies for addressing what had become recognized as a worldwide crisis. The invitation represented extraordinary recognition of her expertise and the impact of her advocacy work. Accepting the UN role required careful consideration of constitutional implications and potential conflicts with British foreign policy positions. After extensive consultation with government officials and constitutional experts, Catherine accepted the position with clear guidelines about her participation and the scope of her involvement. This is an unprecedented opportunity for royal expertise to contribute to global problem solving. Observe Professor Margaret Thornfield, the constitutional law expert who had initially criticized some aspects of Catherine's advocacy approach. She's demonstrated genuine expertise in these issues and earned credibility that transcends her royal status. Catherine's participation in the UN Commission exposed her to global perspectives on youth mental health that enriched her domestic advocacy work. She learned about innovative approaches being developed in countries with different cultural contexts and resource constraints, many of which could be adapted for use in Britain. The international work also highlighted the universal nature of youth mental health challenges while revealing important cultural variations in how these issues were understood and addressed. Catherine became particularly interested in programs that engage families and communities as partners in supporting young people's mental health, recognizing that effective solutions required broad social participation rather than relying solely on professional services. As Catherine's second year of intensive mental health advocacy progressed, she began to consider her long-term vision for this work and its place in her overall approach to royal service. The Youth Mental Health Initiative had become a permanent feature of the royal charitable landscape, but Catherine wanted to ensure its sustainability beyond her personal involvement. Working with organizational development experts, Catherine began planning for the initiative's institutional independence and long-term funding security. She recognized that effective advocacy required building systems and structures that could continue advancing the cause, even if circumstances changed her ability to provide direct leadership. The goal was never to create something dependent on my continued involvement, Catherine explained to the initiative's board of directors. We need to build something robust enough to continue this work regardless of changes in royal priorities or my personal circumstances. The sustainability planning process forced Catherine to articulate her long-term vision for youth mental health advocacy and to consider how her work fitted into broader social change efforts. She had come to understand that addressing mental health stigma and improving services were part of larger challenges related to social inequality, educational systems, and cultural values. This broader understanding influenced Catherine's approach to new advocacy opportunities and her selection of issues to address. She became more strategic about identifying areas where royal advocacy could make unique contributions rather than duplicating work being done effectively by other organizations. The evolution in Catherine's thinking was evident during a major speech she delivered at the Royal Society of Medicine's annual conference. Rather than focusing solely on mental health services, she addressed broader questions about how society could better support young people's overall well-being and development. Mental health cannot be separated from educational opportunity, economic security, safe communities, and strong families, Catherine argued. Effective advocacy requires understanding these connections and working to address multiple factors that influence young people's well-being. The speech demonstrated how Catherine's year of intensive advocacy work had broadened her understanding of complex social issues and developed her ability to think systemically about societal challenges. She had evolved from someone responding to a specific crisis to someone capable of analyzing interconnected problems and proposing comprehensive solutions. As Catherine reflected on the remarkable journey from her initial decision to speak openly about mental health struggles to her current role as a recognized expert in youth advocacy, she felt profound gratitude for the opportunity to contribute meaningfully to addressing issues she cared about deeply. The work had transformed not only her approach to royal service, but also her understanding of her own capabilities and potential. She had discovered strengths she hadn't known she possessed, developed expertise in areas far from her original interests, and found ways to use her unique platform that felt authentic and impactful. Most importantly, Catherine had demonstrated that royal service could evolve to meet contemporary challenges while respecting constitutional boundaries and traditional values. She had shown that being a modern royal could mean more than ceremonial appearances and charitable patronage, that it could include substantive engagement with complex social issues and meaningful contribution to policy development. The young people whose letters continued to arrive daily at Kensington Palace provided constant reminders of why the work mattered and motivation for continued advocacy. Their stories of finding help, developing resilience, and supporting others demonstrated that Catherine's decision to speak out had created ripple effects that would continue long after media attention moved on to other topics. As she prepared for the next phase of her advocacy work, Catherine felt confident that she had found a sustainable model for royal service that honored tradition while responding to contemporary needs. She had proven that courage, sustained commitment, and willingness to learn could transform both individual lives and social systems, creating change that would benefit generations of young people who might otherwise struggle in silence.